This module discusses an overview of Crohn's disease, a common form of inflammatory bowel disease, IBD. This information is taken from a recent review of the medical literature and attempts to be as comprehensive as possible. However, it may not necessarily reflect the experience of your healthcare provider or the specifics of your situation. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendation. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or skip through them in any order you wish. Crohn's disease is a common form of inflammatory bowel disease, also known as IBD, and is a chronic or ongoing inflammation of the intestines. At present, there is no cure for Crohn's disease. Crohn's disease can affect any part of the digestive tract from the mouth to the anus, but it often affects the lower part of the small intestine called the ileum. It will cause the intestines to become inflamed, form sores, bleed easily, scar and lose their smooth inner lining. This picture illustrates the layers of the intestine. There is an inner lining called the mucosa, a layer beneath this called the submucosa, then a couple muscle layers which help propel food along the tract. Surrounding all this is a tough outer coating called the serosa. In Crohn's disease, all layers of the intestine may be involved, and patches of normal healthy bowel can be found between areas of the inflamed bowel. Crohn's disease can affect both men and women equally. Crohn's disease can occur in people of all age groups, but is most often diagnosed between the ages of 12 and 35. Crohn's disease tends to run in families. About 20% of people with Crohn's disease have a member of their family diagnosed with some form of IBD. This means that there is a genetic component to Crohn's disease, but other factors also play a role in its development. People who are of Jewish heritage have an increased risk of developing Crohn's disease. For reasons not completely understood, inflammatory bowel disease such as Crohn's is more common in developed countries and is found principally in North America and Europe. Canada currently has the highest incidence and prevalence of Crohn's disease reported in the world. Incidence is the number of new cases diagnosed each year, while prevalence is the total number of active cases at the present time. In order to better understand ulcerative colitis, you'll need to have some knowledge of the anatomy of the digestive system. Food we eat will pass from the mouth down through the esophagus into the stomach. In the stomach, food is mixed with digestive juices that break down the food into its nutrients. The partially digested food, now called chyme, then passes from the stomach into the small intestine. The small intestine contains three parts: the duodenum, the jejunum, and the ileum or ileum. In the duodenum, the first part of the small intestine, digestive juices from the intestinal wall and the pancreas work to break down food even further. Bile, produced in the liver and stored in the gallbladder, also enters the duodenum to help with the digestion of fats. Most digestion occurs in the duodenum. Once food is digested or broken down into its nutrients, they are absorbed into the body. A small amount of digestion and most absorption occurs in the jejunum, the middle part of the small intestine, and the ileum, the end of the small intestine. The lining of the small intestine is made up of many tiny finger-like projections called villi and microvilli that increase the surface area of the small intestine so more nutrients can be absorbed. Waste will pass from the ileum into the colon. The colon, also called the large intestine, will reabsorb water and electrolytes, such as sodium and potassium, and compact the waste into stool or feces. The colon runs up the right side, across the abdomen, and down the left side to deliver solid stool to the rectum for elimination through the anus. The cause of Crohn's remains unknown. The leading theory is that there is an interaction between the environment and a person's genetic preference, which leads to an abnormal immune reaction, which then leads to inflammation in the intestine. The greatest struggle for researchers is that there is no single gene which has been shown to stimulate developing Crohn's disease, and no definitive environmental factor has been found. Since the disease can affect any part of the GI tract, people with Crohn's disease may have very diverse symptoms. The most common symptoms are cramping in the abdomen in the lower right area, persistent diarrhea, fever, rectal bleeding, and weight loss. Other symptoms may include nausea, vomiting, bloating, fatigue, and canker sores. Some people with Crohn's disease have a distinct area of swelling in the abdomen. Persistent bleeding may result in anemia, a lower than normal number of red blood cells. Children with Crohn's disease may grow more slowly than their peers, and puberty may start late. People with Crohn's disease may have complications such as scarring and narrowing of the digestive tract, which can block digested food from passing through the intestine. Abscesses, also called boils, which are pockets of pus, and fistulas, which are abnormal openings between organs or from an organ to the skin's surface, may develop along the intestinal tract around the anal opening. About 1/3 of patients develop perianal disease, which involves fistulas around the anal area, and fissures, which are tears in the lining of the anus. Nutritional concerns are another common complication of Crohn's disease. Malnutrition is the result of a lack of sufficient nutrients required to maintain healthy bodily functions. Malnutrition can be caused by not eating enough nutritious food, poor absorption of nutrients or malabsorption, and/or high nutrient loss. Crohn's disease can decrease the intestine's ability to absorb nutrients. This is called malabsorption. The bleeding and diarrhea associated with Crohn's disease can also rob the body of nutrients, electrolytes, and fluids. If you have been diagnosed with Crohn's disease, it is important to maintain proper nutritional habits and keep your body hydrated by drinking plenty of water. Other complications associated with Crohn's disease include joint pain and arthritis, skin problems, inflammation in the eyes or mouth, and liver disease. These complications, occurring outside the digestive tract, could be due to the abnormal immune response in people with Crohn's disease and are commonly referred to as extraintestinal manifestations. Diagnosis of Crohn's disease will first involve a thorough patient history, physical exam, and a series of tests. Blood tests may be done to check for anemia, a lower than normal number of red blood cells or level of hemoglobin, the molecule that carries oxygen in red blood cells. This could indicate bleeding from a portion of the intestine. Blood tests may also find a high white blood cell count. These are the blood cells of the immune system and indicate the presence of inflammation in the body. A stool sample is necessary to rule out diarrhea and bleeding caused by bacterial, viral, or parasitic infection. It can also reveal white blood cells indicating the presence of an inflammatory disease such as Crohn's disease. Your doctor may also do an X-ray called an upper GI series and small bowel follow-through to view the small intestine. This X-ray is one of the keys to making the diagnosis of Crohn's disease. In this test, you will be required to drink a glass of barium, a chalky solution that coats the lining of the small intestine, before the X-rays are taken. The barium will appear white on the X-ray, revealing areas of inflammation or other abnormalities in the intestine. If these tests indicate Crohn's disease, your doctor may schedule more X-rays of both the upper and lower digestive tract to see how much of the digestive system is affected. Your doctor may also do a visual exam of the colon by inserting a long, flexible, lighted tube called an endoscope into the anus, rectum, and colon. The endoscope is connected to a computer and monitor so the doctor can see the lining of your intestines. A sigmoidoscopy will allow your doctor to examine the lining of the lower part of your large intestine, your sigmoid colon, and a colonoscopy allows your doctor to examine the lining of the entire large intestine, your colon. During these exams, your doctor will be able to see areas of inflammation, ulceration, and any other abnormalities. If abnormalities are seen, tissue samples will be taken to confirm the diagnosis. A separate module on colonoscopy is available if you wish further information on this procedure. Medical treatment for Crohn's disease may include general nutritional advice, medications, surgery, or a combination of these options. The type of medical treatment you will receive will depend on where the Crohn's disease is located, how severe it is, the complications involved, and your response to previous medical treatments. Although there is currently no cure for Crohn's disease, medical treatment can help control the disease and reduce flare-ups. The overall goals of medical treatment are to control inflammation, which reduces symptoms and restores intestinal function. Ultimately, this will improve quality of life and help to avoid complications, surgery, and hospitalization. Because Crohn's disease is a chronic disease, most people will not only require treatment to get them better, they will require ongoing treatment to keep them better and avoid flare-ups of the disease. There are several oral medications that can be used in the treatment of Crohn's disease. Sulfasalazine, a mesalamine product, can be used to treat mild to moderate attacks of Crohn's disease by reducing inflammation and diarrhea. Patients who are unable to tolerate this drug may be put on other mesalamine-containing drugs, such as Asacol, Dipentnum, or Pentasa. Corticosteroids are powerful anti-inflammatory medications which reduce inflammation quickly. Examples include prednisone and budesonide, which is used to treat inflammation limited to the ileum. These medications may be associated with some side effects, and their use should be carefully discussed with your doctor. Corticosteroids should not be used for prolonged periods of time. A separate module is available which discusses this medication in more detail. Immunosuppressant drugs include azathioprine, its cousin drug 6, mercaptopurine, and methotrexate. These medications are used in patients who do not respond to corticosteroids, patients who cannot completely withdraw from corticosteroids, and for maintenance therapy. These medications require routine monitoring of blood tests and also have side effects, which should be discussed with your physician. While there is no diet that has been scientifically proven to help prevent Crohn's disease, it is suggested that a patient with this condition eat a well-balanced diet and avoid foods that may irritate the intestines during flare-up, such as caffeine and alcohol. 2/3 to 3/4 of people with Crohn's disease will require surgery at some point in their lives. Surgery for Crohn's disease is commonly required if complications arise or if medical therapies fail. It should be understood that surgery for Crohn's does not, unfortunately, cure the underlying disease. Resection is a surgical method used to remove the diseased section of the intestine when a stricture is long or when there are multiple strictures close to one another. The diseased section of intestine is removed, and then the two ends of healthy intestine are joined together. Resection may offer patients years of relief. However, the disease can recur at or near the site where the intestines were reconnected. When Crohn's disease affects the small intestine, areas of diseased bowel may alternate with areas of normal bowel. The areas of diseased bowel may narrow, forming strictures, which can block the digested food from passing and cause severe cramping pain. Strictureplasty is a surgical method used to widen the narrowed bowel without removing any portion of the small intestine. If Crohn's disease severely affects the colon, or large bowel, this organ may need to be removed. Surgery to remove the entire colon is called a colectomy. If only the colon is removed, the end of the small intestine can be attached to the rectum, as shown here, allowing for normal bowel movements. If Crohn's disease severely affects the colon and the rectum, they both may need to be removed. In this case, the surgery is called a proctolectomy, and the surgeon will usually also perform an ileostomy. An ileostomy is a surgical procedure where a small opening in the abdomen, called a stoma, is made, and the end of the small intestine, called the ileum, is brought out through this opening and attached to the skin. Waste will travel through the small intestine and exit the body through the stoma. The stoma will measure about the size of a quarter and is usually located in the lower right part of the abdomen near the belt line. A pouch will need to be worn over the stoma to collect waste, and it will need to be emptied periodically as necessary. Following surgery, patients can go on living a normal and active life. Because Crohn's disease can recur after surgery, carefully consider the benefits and risks before surgery. Surgery may not be appropriate for everyone, so please discuss your options with your doctor. About 1 out of 4 adults with Crohn's disease will develop a fistula or abscess over their lifetime. Recall that an abscess is a tender pus-filled cavity and a fistula is an abnormal tunnel between the organs or from an organ to the skin surface. The most common place for patients to notice these are around the anal opening. An abscess must be drained. Draining can be done with a needle inserted through the skin and guided to the correct location with the help of a CT scanner. Surgery may be required to drain the abscess or remove the abscessed portion of intestine. Fistulas are initially treated with medication, but if the fistula is causing symptoms that don't respond to medication, surgery will be required to remove the diseased intestine and repair the affected organs. A few important points should be made regarding the post-operative care following these major bowel operations. Before and after surgery, most patients meet with an enterostomal therapist who is a specialized nurse performing a vital role in educating and counseling patients both prior to and following ostomy surgery. This nurse will demonstrate how to use and care for any appliance required, how to maintain healthy skin around the ostomy, and can provide counseling on how to adjust to living with an ostomy. If you have had your colon removed and have an ileostomy or pouch, you may have to avoid certain foods in the diet, such as seeds. People who have had their ileum removed may need to follow a lower fat diet. Finally, It is not unusual for kidney stones to develop after surgical removal of 1 meter or more of the ileum, and this should also be discussed with your doctor and watched for. If you require surgery for Crohn's disease, please speak with your doctor about what you can expect following your surgery. Research has shown that pregnancy and delivery is most often not an issue with women with Crohn's disease. However, women with Crohn's disease should discuss the matter with their doctors before and during pregnancy. In summary, Crohn's disease is a common form of inflammatory bowel disease, or IBD, and is a chronic inflammation of the intestines, affecting the entire digestive tract, especially part of the small bowel called the ileum. There is no known cause of Crohn's disease. Symptoms can be persistent, moderate to severe diarrhea, abdominal cramping, rectal bleeding, fever, and weight loss. Diagnosis of Crohn's can be made through a physical exam, blood test, stool sample, an upper GI series and/or colonoscopy. There can be many complications of Crohn's disease, such as malnutrition, malabsorption, scarring, abscesses, and fistulas. Medications and supplements can be taken to help reduce the inflammation, ease the symptoms, and correct nutritional deficits. Surgery is often necessary to correct complications such as blockage and to relieve symptoms. However, surgery is not a cure for Crohn's disease. This slide lists some of the many resources available where you can find more information about Crohn's disease. These current references were used to assist in the preparation of this module. These references were also used. All of these are available through the internet or your local medical library if you are interested in more detailed reading on this subject. We sincerely hope that this module has furthered your understanding of Crohn's disease. We wish you the best for the future, and thank you once again for using MD Conversation.